You're watching this video because your doctor has recommended a craniotomy for brain tumor. This is surgery to remove part or all of a tumor which is growing against or inside the brain. When undergoing a craniotomy, you'll typically have general anesthesia, also known as being put to sleep. You'll have a urinary catheter inserted which will allow urine to drain from the bladder into a bag while you're asleep. You'll then be positioned on your back, side or front, depending on the location of the tumor within the head. A metal head clamp may be used to hold your head safely. Some of your hair will need to be cut or shaved to prevent infection getting into the wound. Where this will be and how much hair is removed will, again, vary depending on the personal requirements of your operation. Sometimes 3D computer technology, like satellite navigation for the brain, is used to help the surgeon during the operation. To begin, your surgeon will make a cut in the skin of the scalp. Special drills are used to make a variable number of holes in the skull. They're designed to stop if they reach anything soft. A special bone saw with protective footplate is used to join the dots and a window of bone is opened. The incision and bone window will vary in size, shape, and position depending on your personal requirements. In this video, we show a larger than average incision and bone opening. Most are smaller. The tough lining around the brain, known as the dura, is then opened to reveal the brain. The surgeon will then carefully navigate to the area of abnormality. This can vary between patients, and the path to the tumor will be chosen by the surgeon to cause the least damage to important structures within the brain. The surgeon will then carefully remove as much of the tumor as possible. There are different tools, techniques, and equipment that may be used depending on what they encounter. Here, we show an oversimplistic version of the tumor being removed. If there's a very high risk of causing damage to the brain, the surgeon will stop, even if that means leaving some tumor behind. Sometimes a sample of the tumor can be sent to the laboratory for a rapid analysis during the operation. This is not as accurate as the full results, which normally take days to process. However, this early information may be useful to guide what the surgeon does next while you're still asleep. The surgeon will then take time to make sure any bleeding is under control before closing the dura and bone window. There are different ways to do this, but usually involve screws, plates, or bone clasps to reattach the bone. The healing process will fill some of the gaps left behind, but there may be permanent small bumps that you can feel. This is usually, but not always, covered up by the scalp and hair. To finish, the surgeon will close the scalp with sutures or staples. There may be a drain left in place to drain off excess fluid from the surgical site, which will usually be removed in the first few days after surgery. You will have a wound dressing and may have a head bandage applied as well. Please ask your surgical team for your personal post-operative plan after the procedure is finished, so they can give advice based on your needs. When considering whether to have a procedure or treatment, you should consider the potential benefits, the potential risks, and whether there are any alternatives available, such as medication, radiotherapy, less invasive procedures, or even not doing anything at all. You should take time to ensure you've considered all of this carefully. Between 1 and 5 in every 100 patients suffer from minor or treatable complications from this surgery, such as infection, which is when bugs get into the wound. You may need antibiotics to treat it. Bleeding or bruising. You may get a black eye if the bruising travels downwards. This usually resolves on its own over a few weeks. Seizures or fits, which are a sudden uncontrolled electrical disturbance in the brain. It can happen because of irritation to the brain during or after an operation. It's treated with medication that reduces seizure activity. Headaches. Some patients suffer from these after surgery. This is often temporary, but it may, unfortunately, be permanent. CSF or cerebrospinal fluid leak, which requires you to stay in the hospital slightly longer to ensure it heals up before you can go home. If it doesn't stop on its own, you may need a drain or another operation to fix it. Hydrocephalus, which is a buildup of fluid within the brain. This may require a drain to be inserted during the operation or at a later date. Pressure on skin, nerves, or eyes. Problems with positioning during the operation, which might include pressure problems, skin and nerve injuries, and eye complications, including, very rarely, blindness. Special gel mattresses and operating tables are used to minimize this. Residual or recurrent tumor. The purpose of this operation is to remove all or most of the tumor as safely as possible. However, if there are parts of the tumor which are stuck down or too risky to remove, your surgeon may leave it to prevent damaging the brain further. If any tumor is left behind, it will grow again if left untreated. Even if the surgeon thinks it's completely removed, there's a small chance that a few microscopic cells are left behind and the tumor may regrow. You'll need further scans in the future to keep an eye on this. Further treatment may be required. More serious and sometimes untreatable risks include stroke, which is a type of brain damage. Brain operations can cause strokes in up to 5 out of 100 cases, but can be higher, depending on the area of the brain being operated and the abnormality. A stroke can lead to weakness, paralysis, problems with sensation, speech, memory, vision, concentration, or personality changes. If it's a large stroke, you may not wake up properly. The changes you experience will depend on the area of the brain affected. Different parts of the brain have varying functions and importance to your ability to live your life normally. There's no medical treatment that reverses a stroke. However, in some cases, the brain forms alternative pathways to help overcome the problem caused by it. If you suffer a stroke, you may require a prolonged period of rehabilitation at a rehab center or even at home. It may significantly affect your ability to work and live your life fully. Medical or anesthetic complications, such as blood clots in your legs or lungs, which may affect your breathing, heart attack, and other medical or anesthetic problems can occur. Death. Rarely, death as a result of damage to major blood vessels or vital brain structures. If one of these uncommon risks turns into a complication, extra procedures may be required, such as blood transfusion or further surgery. Thankfully, for most patients, there'll be no complications. You'll be encouraged to mobilize as soon after the procedure as you can. Most patients go home within a few days. The surgical team will be in contact about next steps and if any further treatment is required once they get results from the laboratory. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.